thank you guys for coming out this evening. I want to thank Michael Glotz in the Village for having me out here to help share about Medicare. Hopefully through this, we're going to try to make Medicare a little bit more easier for you, okay? So I'm your presenter today. Again, my name is Tina Konieczki. My company is right here local in TK Insurance Services, right here in Tinley Park at 165th and Oak Park Avenue, all right? A few quick housekeeping rules. If anyone has their phone on, like mine just beeped a couple minutes ago, if you can silence it so it's not interrupting throughout the seminar. And then obviously the bathrooms are right out the back. If anyone has to use the bathroom, please go ahead and just make your way on out there. We won't point you out. If anybody would like some water or coffee or cookies, please just go help yourself. Thank you to the Village for supplying that for each of us. Thank you. All right, so a little bit about me. I started out in the insurance business back in 1998. I did life insurance and loved it. Swore up and down I'd never do Medicare. I thought it was a foreign language. And so many years went by, was in and out of it, came back into the insurance business back in 2015, and went right into the life insurance again, and home and auto and all those other things. But then I saw all the misinformation out there, and so I decided to deep dive into Medicare and to really truly understand it. Now, I have an education background. I was a teacher for many years. I was an assistant administrator of a Christian school, and I taught the wee little ones. So now, whenever they would learn and they would catch on to something, that light bulb, that gave me joy. I really loved watching them learn. And now I'm on the other end of the spectrum, and I saw how confusing it can be. Who in here thinks Medicare can be confusing, right? And then they keep changing things. So I decided to deep dive into what Medicare is to really understand it so that I can go out and really help navigate that Medicare maze. They make the jargon very confusing, and then depending on who you call, you get a different answer, whether it's your different government agencies or your neighbor or your family member. They all have their own opinion, right? So my goal for you is to help you to be able to navigate through that process. And I'm not somebody who's trying to sell something tonight. This is an educational seminar. So don't worry about it. Keep your wallets put away. I'm not trying to sell something. This is educational for your benefit, all right? So every year for my clients, I always offer a no cost, and I don't charge for my services. I do reviews every year because things change every year, right? So it's very important. The government actually says in that book that you have this Medicare in your book like 4 different times. They say you should review your plan every year because of the changes. So if they say it at least 4 times, it's kind of important, right? Yeah, so, and I'm non-biased. I'm a broker. I don't work for Medicare. I don't work for any of the companies I represent. I work for you, and you, and you, and you. For each one of you, right? I'm here to help you navigate and be a resource for you as your healthcare and goals change, as Medicare evolves and change. I'm there for you to help you through that process. So I try to stay involved as much as I can in the community on top of running my business. I'm an ambassador on the chamber in Tinley Park, and I do seminars continually throughout the year. It's not a one and done, right? Because of all the new laws, I continue to do these seminars, whether it's at Tinley Park District, at the different senior centers, at the Village, at the, here as well, but at the VFW and many other places. So just really to keep people informed. So some of the things that we're going to cover today, we're going to talk about what is Medicare. We're going to talk about the ABCDs of Medicare. We're going to talk about where do you enroll? When do you enroll? How do you enroll? How should you enroll? How much does it cost? These are all questions that I get asked all the time. People are always calling my office and asking me these questions. They're important questions. So we're also going to talk about the key changes in a bill that was passed, the IRA, the Inflation Reduction Act, that is going to directly impact each one of you in one capacity or another. We're also going to talk about Medicare supplements versus Medicare Advantage plans and the differences and changes. We'll talk about prescription drug plans as well, okay? So you have a lot of different options, and that's what's important to know. You have options, right? So there is no cookie cutter plan out there. Everybody's individualized. I have clients that come to my house, to my office, husbands and wives. They are in different plans and even different types of plans, different companies, because they each have their individualized needs, and we do an analysis to determine what is best for you, okay? So that's truly important. So you want to make sure, whatever you're doing, you want to make sure that you're doing what's in your best option or best interest, because you don't want to end up with penalties. And too many times people make the wrong choices and they end up with penalties that never go away. So that's really important to understand. Here's a question for you. Does anybody know when Medicare first started? Think about that. Think about how old you gotta be. It started in 1965, in July of 1965, and it consists of Part A and Part B, and it really hasn't changed much since it first started, okay? It's a healthcare insurance program from the federal government, and you have several options when it comes to your healthcare. So Medicare, unlike group insurance, is individualized. It's not a plan that you're on with your spouse. You have your plan and they have their plan, so everything is individualized, no group policies. You're eligible when you first turn 65, or if you are on Social Security disability in the 25th month, you're eligible to enroll. Or if someone is diagnosed with end-stage renal disease, kidney failure, they also are eligible now for Medicare. It's administered, does anybody know where you sign up for your Medicare? Online. Where online? Medicare.gov? Google? No, actually it's not. It's SSA.gov. It's at Social Security. Social Security is the office where you would enroll, where you would go on. You can go online, absolutely. And you can create your account, SSA.gov, and you can enroll in Medicare. You can also call them and do a phone appointment, and you can also get signed up that way. Some of these Social Security offices are now open, and you can actually make an appointment and go in, or go stand in that lovely line and ask for someone to help you, all right? Or the Railroad Retirement Board, you can also enroll there, okay? So let me ask you this question. Since you have to go to Social Security to enroll in Medicare, do you have to take your Social Security? No, you don't. Just because it's where you sign up there, that is a whole different entity. You don't have to. In fact, sometimes it may be in your best interest to allow it to delay until you're fully vetted, whether that's 66 and 10 months, 67 months. It all depends on when your birthday is. Will dictate when you're fully vetted, and it'll keep going all the way up until you're 70. It'll continue to grow, okay? So when should you apply for Medicare? Does anybody know? 2 months? 3 months before? Okay, so you have a 7-month window. 3 months before your birthday, the month of your birthday, 3 months after your birthday. So it's always going to be best in your best interest to do it within that 3 months of your birthday, right? So that way, in the month of your birthday is when it will start. So if your birthday, let's say your birthday is in December, and we're in October, and you signed up, when your birthday was, let's say it was on Christmas, December 25th, when would your Medicare start? December 1st. It's always the first of the month. Now, let me ask you this question. What if your birthday was on December 1st? When would your Medicare start? Anybody know? December 1st. I'm answering, I'm saying what you're saying. No, actually that's not correct. If your birthday lands on the 1st, it is always on the month prior on the 1st. So some people, mess that up. But if your birthday lands on the 1st, you qualify for Medicare the month before. So that's called your initial election period, that 7-month window. So what about if you were working? Do you have to sign up when you turn 65? Yes? Who in here thinks you have to sign up for Medicare when you turn 65 if you're working? The answer is actually no. If you are working with credible coverage, as good as Medicare, Social Security may tell you that, and your friends may say, you have to go, you're going to end up with a penalty. The answer is no. If they'd only read their own laws and their own, what they put out, the government puts out, Medicare says, if you are working and you have credible coverage that pays out as good as Medicare, so if it pays out and you're working, you can stay on your group insurance plan. I would always encourage you to do a review, because you don't know if it's the best plan for you unless you know what else is out there. So you would always want to, every year, take a look at what's on the individual market and compare it to what you are being offered on your group retiree plan. What if you are on your spouse's insurance and you turn 65 and your spouse is still working? Do you have to pick up Medicare then? Anybody? No, you don't. Because your husband or your wife or your partner is carrying that credible coverage and they're working. So you're covered underneath them, so you will not incur that penalty. So it's in your best interest to take a look at what you got, see what's being offered. You also want to, it might even interrupt your household, right? If your spouse is on your insurance and you turn 65 and you go on Medicare, what happens to your spouse? They lose their coverage, correct? Absolutely. Ma'am, if you want to grab one of these folders. So you want to make sure how it impacts your household as well. There are people that are turning 65 that have children under 26. You think that it will impact them? Now they got to get a job and get insurance, right? Might be an incentive right there. So you want to make sure. But the answer is no. You do not have to get Medicare as long as you have credible coverage as good as Medicare. So let's say you turn 65 and you're 5 months down the road and someone says, and you're in a company that you're working part-time with 10 people in the company, and your friend says, you're 65. Are you on Medicare? And you're like, no, I have insurance at my company. What happens? You get a penalty then? Yes. The answer is yes. You will have a 10% Part B penalty. And then guess what? You just found out about it. Can you go sign up at Medicare? No. You have to wait all the way to the following January until what's called open enrollment. Open enrollment is January 1st to March 31st. During that period of time, you can sign up within those 3 months, and it will actually start in the next month. If you miss it in that 3 months, guess what? You have a 10%, another year, 10% penalty of the cost of Medicare, and you have to wait till the following January. So it's really important to know the rules, and should you sign up or not, right? And when you should sign up. That's really important. Now, let's say you were working, and you have excellent insurance, and you have a spouse on your insurance, and you want to work until you're fully vetted. Maybe that's 67. You feel healthy, and you want to keep working. When you retire, that's when you have the opportunity to go on Medicare, and you have what's called a special enrollment period at that point. So you would want to, at least 30 days prior to losing your credible coverage, you would want to enroll in Medicare. There's 2 forms you're going to need. When you're past your initial election period, Medicare wants to know that you have that credible coverage. So you need proof, right? So the 2 forms, one form is called an L564 form. That is the form that your employer would fill out, giving you proof of credible coverage. And then there's another form called a CMS 40B form. You would say, okay, I'm ready for my Medicare now. So you'll fill out that Part B form, that form, that CMS 40B form. You'll take both of those forms, and where do you go with those forms? Where do we sign up for Medicare? Social Security. You're going to take both those forms over to Social Security. Many times they'll say, drop it in the bucket. You're going to say, no, thank you, I'm here for a service. And you ask them to expedite your paperwork so that you can get that on the next month. Yes?
What was that first form you said?
L as in Larry, 564. It is proof of credible coverage that goes to your employer, okay? So you need both those forms, and once those, it's 30 days prior. You don't want to go before that, because unfortunately if you go before that, you're going to be paying Part B premium while you're still covered at your job. So you go the 30 days prior, the first before the month that you want it to start is when you take the paperwork in, okay? All right, so it's very important to know when you should show up, if you should sign up, and when you should sign up, all right? Because you don't want that penalty. That 10% penalty stays with you for life, right? So you want to make sure you don't do that. All right. And the government, again, as I say, they always say you should definitely do a review every year. All right. So every year Medicare changes. Plans change every year. Prices go up every year. Inflation goes up every year. So the cost of Medicare does as well. So when you're looking at your group insurance policies, if you're still working and trying to consider, you're going to look at what your cost is, what your deductibles are. So many of these group insurance plans might have a very large deductible, might have a very large max out of pocket, and very little benefits. That's why it's important to take a look at that, all right? So let's take a deeper dive into look at the ABCDs of Medicare. So your Part A is considered your inpatient hospital care, your home health care, and your hospice care. Your Part B is considered your medical services. That consists of your in- and outpatient doctor services. So all your doctors on the inpatient hospital care and on the outpatient hospital care, all of your preventative services all fall under Part B. Your diagnostic tests, your MRIs, your CTs, your radiology, and many of your therapies, like your occupational therapy, your physical therapy, speech therapy, a lot of your durable medical equipment like CPAP machines, oxygen, walkers, prosthetics, orthotics, so all falls under durable medical equipment. Even chemotherapy all falls under Part B, and so and that's all your medical services. Then you have your Part C. That is your Medicare Advantage plan. That's the alternative solution to original Medicare. It's a bundle package. It really works a lot like your group insurance with your Part A, your Part B, and many of the plans have a Part D in them and added benefits. We'll talk about a little more about that in a minute. And then you have what's called your Part D. That's your prescription drug plan. So that's where there's several ways you can get your prescription drug plan. You can get your prescription drug plan on a standalone drug plan. You can get a drug plan that's embedded into an Advantage plan. And you get a drug plan, many get it at the VA. Do we have any vets in the house? Any veterans? All right, great. So love my vets, but that's a viable option is to get it at the VA if you're there. All right, so there's a lot of holes in Medicare. There's a lot of things Medicare doesn't cover. And one of the biggest misconceptions is a lot of people believe that Medicare is free. And Medicare is not free. So if anybody if you had a job and you've been working, you've been paying into Medicare from day one when you started paying taxes. You know that little FICA on your paycheck? You were paying into Part A, right? So it's not free. So let's talk about some of those numbers. So as I said, Part A is your inpatient hospital care, right? So that is your facility services cost. It goes on 60-day increments. So if you were admitted into the hospital as inpatient hospital care, day one, you have a $1,632 deductible. If you're out of the hospital for an extended period of 60 days and you went back into the hospital, you would incur another $1,632. Now let's say you were inpatient care and you were there past that 60 days, days 61 through 90. That is $408 a day on top of that deductible. Let's say you're in ICU or a coma or something else and you're there past that time. Days 91 through 150, those are called your lifetime reserve days. Those are $816 a day. You think that's quite catastrophic? If you're in the hospital, and let's say you're unhealthy and you're in and out of the hospital several times a year, they can be quite costly. But I tell you, that's not the catastrophic part of it. The catastrophic part of it falls under Part B. So Part B also has a premium. And that premium is dictated by what your income is. So when Medicare looks at your income, If it's single, they look at single. If you're married and filing jointly, they look at that. They always look back 2 years. If you're in the national average for a single person is above poverty up to $103,000. If you're married and filing jointly, that number is $206,000. So if you're anywhere in that realm, then the national average is $174.70. And remember I said Medicare is not group, it's individualized. So each one of you would have your own premium to pay to Medicare for Part B of $174.70. Now, if you made more than that, you made more than 103 as a single or more than 206,000 as a married couple, there's something called IRMA. She is not your friend. IRMAA, Income Related Monthly Allowable Adjustable Income, and depending on what your income is, will dictate what the cost of your Medicare will be. Now I have several different clients that have a much higher income and they're paying over $300, over $500 a month. Big difference, right? So some people that they'll realize is that when you're working and you're making this large income, that's what they're looking at 2 years ago, correct? But when you retire, majority of the people are not making that same income. Now, if you take investments, distributions, or you have property you sell, that's all considered what? Earned income, right? So they're going to look at that. But typically, you're not making the income you were making while you were working. So there's something called a redetermination. And I have sent several of my clients over to Social Security and told them to ask for a redetermination because it's been a life change. Even though you made that money 2 years ago, you're not making that kind of money this year and going forward. So if you ask them for a redetermination, most likely if you can prove that you're not making that kind of income, it'll bring that down to a much more affordable amount. All right? All right. All right. Yes?
Do they count your Social Security then when they're figuring this out? Because I'm not 65, I'm 71. So they're going to take my Social Security I get, plus my part-time job?
So I am not certified in that, and I'm going to always redirect you to your accountant, all right? So check with your accountant to see how that works, all right? Now, I did want to mention one thing. When you were working, because I forgot this point, when you're working, one of the reasons why, when everyone says, yeah, I'm supposed to sign up for Part A, and I said you don't have to, one of the reasons why you may not choose to sign up for Part A is if you're contributing to an HSA. Everyone know what an HSA is in here? Health Savings Account, right? Your pre-tax dollars you're contributing to it, those are wonderful, and a lot of times your employer will help contribute to that, correct? That's free money. So those are great things. Those things stay with you for the rest of your life, and it will help pay your medical bills. The government says you cannot contribute to an HSA within 6 months of getting your Part A. So it would be in your best interest not to sign up for Part A if you are contributing. And I hear, well, I don't have one. If you're going to keep working next year, do you know what your company is going to offer you next year? They might choose a high deductible plan and offer you an HSA, and they may contribute and you have no choice. So that's why a lot of times I tell people not to sign up for Part A if that's a possibility or if they're contributing, right? Get that free tax dollars. It helps you in the long run. Every one of you who have a packet also has one of these forms inside your packet. Do you see that? Okay. In that form, it shows you that you have options. So Medicare, as I said, is your original Medicare, is your Part A and Part B, and that's your base, right? So because of all the holes that I just talked about, the cost and Medicare, your deductibles, your co-pays, your out-of-pocket expense. So we talked about all the Part A. On that Part B, you had it was 174 for the national average. You also have a $240 deductible. It's not a $60 deductible, but it's a yearly deductible, right? And then Medicare will cover 80% of the Part B coverages cost as long as they approve it. And that leaves you with 20%. Does that sound like a lot of money? Well, the problem is it's uncapped. So that can be catastrophic, even more than Part A, right? Just a few days in the hospital, you're looking at thousands and thousands of dollars, and paying an uncapped of 20% can be quite costly on your pocketbooks. So it's really important to fill the holes in Medicare, to choose a plan that will help cover some of those holes. So as I said on here, it shows you two different options, two different roadmaps, if you will, to pick up, you not only have your Medicare, you can pick up a drug plan and a supplement, a Medigap plan, or you can pick up an Advantage plan, all right? So two different options for you. So let's talk about supplements first. Medicare supplements, they are standardized by the federal government. You must have your Part A and Part B, right? You have a premium that you would pay every single month, and it helps cover all your Part A costs, and it helps cover the Part B cost, the 20% that's out of pocket. So a lot of people say that's my secondary insurance. I call it my pocket insurance. It's the money that's coming out of your co-pays, your co-insurance, the money that's coming out of your pocket. Because in reality, if Medicare doesn't cover something and they don't approve something, your supplement's not covering it either. And it doesn't go above and beyond what original Medicare covers. So you want to make sure that whatever plan you have, that it's being approved before that procedure or surgery is done, right? You want to make sure that you have an approval process. So, and again, just like Medicare, supplements aren't for couples, it's individualized, just like Medicare is. So you can't have one policy cover two people. And back in 2006, they separated the prescription drug coverage out of the supplement. So all the drug plans that were a part of the supplement are no longer credible coverage, so you have to get a standalone drug plan if that's the route you're going to go. Yes?
Regarding the supplement, does that have to be purchased annually along with the A and B, or can that be dropped and renewed any time, the supplement?
So supplements, they do not follow the annual enrollment period like the Advantage plans and drug plans do. You can get a supplement at any time, absolutely, but you just can't have both, right? So when you're looking at a supplement, there's an open enrollment period on the supplement as well. It's the first 6 months. Once you get your Part B, you have 8 months to get it, but you have 6 months that you have guaranteed issue. It's an open enrollment period that you have no medical underwriting questions. Outside of that 6 months, they have the right to rate or decline you. So it's important to know when should you get a supplement or not get a supplement, and know the rules that go along with it, because you might later on not be able to get one, right? It's depending on what your health situation is. So because in, I believe, 1992, they standardized all the supplement plans. So Plan G is Plan G is Plan G. It doesn't matter what company it comes from. If Medicare approves the procedure or the surgery or whatever it is, by law, the supplement has to approve it. Does that make them equal? Does that make all plans equal? What do you think? No, it doesn't, right? So there's a lot of plans on the market that may be much lower, some are higher, some might offer different benefits, added benefits, and things of that nature. Whenever I'm looking at a supplement for one of my clients, if that's what they're looking for, I'm looking at stability. Stability is one of the most important things. You have a lot of companies that are on the market that might come in really low and it lures you in, but they're not stable. They are notorious for closing their book of business. No new Medicare beneficiaries can go in there. We all pass on at one point, so people leave, or it gets too costly, and they leave that and go to another type, maybe an Advantage plan or a different plan. So that book of business gets smaller and smaller. So what happens with the liability, in order to sustain that book of business, the price has to go up, right? So whenever you're looking at a supplement, that's one of the most important things. You want to look at the longevity of it, you want to look at how it's performed. You want to look at the stability of a company, okay? So that's really important. But on a supplement, there are no networks. You have your choice of hospitals, your choice of doctors, right? There's still a Medicare network, right? You have to make sure they'll take Medicare, and you have to make sure they take new patients. There's a lot of concierge doctors out there that don't accept Medicare. And then there's doctors out there that accept Medicare but don't accept Medicare assignment, right? They're allowed to charge you up to 15% above and beyond what Medicare approves. So you want to make sure that your doctor accepts Medicare, all right? Typically your premium goes up every year according to your birthday and inflation. So you want to make sure you're in a plan that's quite stable. We've seen a lot of increases this year, and I will touch a little bit in the end about the Inflation Reduction Act and some of the reasons why, some of these have taken some increases. So some of those holes in Medicare that I talked about, also your Part A hospital coinsurance, your deductibles, your excess charges. Medicare doesn't cover your first 3 pints of blood. And Medicare doesn't also, if you're inpatient in the hospital and they want you to go to rehab, Medicare says there's a 3-moon rule. They will not approve you to go to a rehab unless you're inpatient in the hospital 3 midnights, 3 overnights, not 3 days, but 3 overnights. So that's important to know if that's a concern, all right? All right, now we're going to go ahead and jump on over to Medicare Advantage plans. Medicare Advantage plans, as I said, is your alternative to your original Medicare. It's kind of like your bundle package. You have your hospitalization, your doctor services, you have, many of them have a prescription drug plan included in them, and then some added benefits as well. So it is network-based. You have HMOs, you have PPOs, you have PFFS plans, you have MSA plans, you have chronic, it's called a CSNP, a chronic plan, and you have dual plans, someone who's Medicare, Medicaid. Illinois doesn't have any D-SNP plans on the market, all right? So, interesting statistic that the government says there are now over 54% of people in these Medicare Advantage plans. And they say that people are healthier on the Advantage plans, on these managed care plans, because it's a proactive approach to their health care versus a reactive approach for just original Medicare, all right? So they're giving the added benefits. A lot of them have some, added benefits for wellness and they incentivize you to take care of yourself through a lot of those added benefits. All right, now we're going to talk a little bit about Part D, your prescription drug coverage. This is really important, right? As I said, in 2006 is when they separated it from your supplement, and they also implemented that wonderful 1% late penalty. Unfortunately, for a long time, you didn't see a lot of advertisement on this, and a lot of people didn't know about it. They may have only had a blood pressure drug or a cholesterol, and they used, different things like Walgreens plan back in the day or their Walmart plan, and then people were using the GoodRx, and they thought, well, why do I need a drug plan? I don't take any drugs, or I take maybe one. Unfortunately, it could come back to haunt you, because that 1% of the national average, it adds up really quickly. That's 1% of the national average for every single month you don't have it. In fact, back in 2019, I had several people come to me that were in their 80s that ended up having some health challenges and ended up having to take some very expensive drugs that never had a drug plan. And now they're paying a penalty of over $60 a month on top of their premium, on top of the cost of the drug. And guess what? That penalty never goes away. So you want to make sure that whatever plan you take, you want to make sure you have credible coverage when you're eligible for it. All right? So as I said, you can get a prescription drug plan on its own, a standalone. You can get it if you're a veteran through the VA, because it's credible coverage, or you can get it inside of a Medicare Advantage plan. There's even some group retiree plans that offer credible coverage. So looking at that, all the drug plans, they have different tiers, tiers 1, and some plans are all the way up to tier 6. So you have your preferred generics, your regular generics, your preferred brands, your regular brands, and then your specialty drugs. And even there's a tier 6 for some of the plans that have a specialty diabetes drugs. You also have prior authorizations on some of these drugs. Some have step therapy, where you want to make sure that the drug that you're taking. If it doesn't work, then they step it up, okay? The pre-authorization, especially on narcotics and different things of that, you might have to get the approval process on some of the drugs. So in 2024, all the drug plans across the country, they work the same way. They have 4 stages that will be changing in 2025. So there's a deductible stage, there's an initial stage, there's, who's heard of the donut hole? Coverage gap, and then you also have a catastrophic stage. In 2024, the deductible, the government said they can charge up to $545 for a deductible. So you would pay the retail cost of your drugs until you hit that deductible, and then you would move into the next phase, which is your initial phase. Whatever plan that you're on and whatever tier your drug is will dictate what the copay is, which is a set amount, or the coinsurance, which is a percentage. And you will pay that until you and the company will pay the balance until you hit $5,030. Once you hit $5,030, then you go into the donut hole or the coverage gap. You will now pay 25% of the retail cost of both your generic and your brand name drugs. In the coverage gap, the manufacturer will also help you, and they will submit a 70% discount, helping you to get out of that donut hole to reach the amount of $8,000. Once you reach $8,000 in 2024, you go into the next phase, which is called the catastrophic phase. In 2024, you paid $0 in the coverage gap. That kind of went away. It's just that you're not paying anything else, all right? Medicare is assuming 80% of the cost of your drugs through the rest of the year. That will be changing in 2025, and we'll talk about that in just a minute. So those are the different stages that you have with your drug plan, all right? You want to make sure, as I say, I can't stress enough that whatever drug plan that you have, it's credible coverage, all right? So there's a lot of things that Medicare doesn't cover, and a lot of people get caught up in this when the need arises. And that's custodial care, long-term care, dental care, vision, your eyewear, hearing, all the things that seem to ail us as we get older or fail us as we get older, right? So unfortunately, Medicare doesn't cover those things. I can't tell you how many phone calls I get to tell me, oh, I had a stroke, I need someone to come take care of me, I'm by myself. Medicare doesn't pay for that. So it's important not just to be getting a policy, right? It's about being fully covered and having a plan that is gonna take care of all of your needs when those needs arise, right? Whether it's a hospital indemnity plan to help with your hospital costs, or it's long-term care, short-term care. There's a lot of great recovery care plans out there. There's dental plans and vision plans and hearing plans. So whatever plan you decide to go on, you want to make sure that you have that extended care insurance to help you in your time of need, and not at a point when you get there and now you're not eligible for such plans, all right? So that's really important. There are a lot of state and federal assistance programs out there. One of the programs, and I preach this all the time to my clients, is called Extra Help. It's a program that's offered through the state and Social Security that if you qualify for it, it will help lower the cost of your prescription drugs. So it's a quick phone call to Social Security. Nothing's quick about Social Security, I just lied. But it's a phone call to Social Security to see if you qualify, and it can substantially reduce the cost of your prescription drugs. So I would take advantage of that to see if you qualify, all right? And I'm gonna wrap up tonight with a little bit about that Inflation Reduction Act. Who's heard about that? All right, so the Inflation Reduction Act can truly impact you and your pocketbook and your plan. It was implemented, and the bill was passed in 2022, and it really was designed to tackle inflation and to provide some relief to folks just like yourself, right? So you're going to negotiate some of the prices, right, in 2026. And so you should be seeing a reduction in the cost of some of your prescription drugs and your out-of-pocket costs through that. So hopefully that it will help support a lot of the things that you have that coming out of your pocket, right? So it's a huge relief and helps you to budget more effectively. So when it got implemented in 2023, when we saw some of the changes coming by, they allowed some of the vaccines, some of the preventative services, some of the screenings at no cost to you, right? Prior to that, if you went to the doctor's office, you were paying for them at the doctor's office. You had to, don't raise no hand, but shingle shots, those weren't cheap, right? You had a two-shot process. Now, in this bill, it allowed you to get them at the pharmacy so that and it was at no cost. It's being covered by Medicare, all right? And then, so it helping you stay healthy without worrying about any additional expenses. Who in here thinks the prescription drugs is unreasonably costly? All of us, right? Absolutely. Well, they did a poll and they asked all these different adults. 82% of folks, just like yourself, believe that prescription drugs are cost way too much, right? 30% of them do not take prescription drugs as prescribed. And you might know somebody who might relate, right? You break it in half, or you skip a day to help it to last, because you can't afford to get it, right? And then they said 28% of people don't even pick up the prescription drugs because they can't afford it. We live in America. That's sad that we can't take care of ourselves because we can't afford our own medication, right? There is some good news in the act. It can help alleviate some of the stress. The government sees the IRA, the Inflation Reduction Act, as a real solution. So it was meant to have access, affordability, and sustainability. So the access is to be able to get some of those vaccines at no cost. Affordability is to help make it lower cost, and the sustainability is so it can have the longevity even with Medicare. And we'll talk about that more in just a moment. So we're going to talk about all the key changes in this bill, in this Inflation Reduction Act. So from 23 to 25, there's a lot of Part D improvements. In 2023, as I said, the vaccines without no copays at the pharmacy. One of the other things that they did in that bill in 2023 was they capped the insulin. So now hear what I'm saying, if your insulin was on your formulary, they couldn't charge you more than $35. Unfortunately, the carriers were dropping some of those brand name drugs. I got several phone calls. Tina, my drug is no longer covered on my formulary. So you want to make sure that your drug is covered on the formulary. Otherwise, you're paying a lot more for that insulin out of pocket, right? One of the other things that they did was in 2024, I talked about extra help. In 2024, they expanded it. So as long as you made up to 135% above poverty in 2024, you were eligible for the extra help. In 2024, they expanded it to 150% above poverty, allowing more people to have access at lower cost drugs. So that's really important to make that phone call to see if you qualify, because their goal was to make it accessible for a lot more people to lower the cost of their drugs. So they expanded the threshold, okay? In 2024, as I alluded to already, that fourth stage, they eliminated that. So there was essentially a cap on what you were paying once you hit the $8,000. You didn't pay anything in the catastrophic stage. In 2025, who likes that donut hole? Anybody? No, right? Nobody likes the donut hole. I like the holes, not the donut holes. But in 2025, donut hole's going away. Can we all say yay, right? That's going away. So a lot of people went broke trying to pay for their retail cost of their drugs 25%. So think about that. If your drug is $1,000 and you have to pay 25%, and let's say you're on a couple of them drugs, that's a lot of money coming out of your pocket, is it not? So that's a big difference, right? So in 2025, not only is the donut hole going away, they're going to cap your prescription drug cost at $2,000. $2,000 out of your pocket for the cost of your drugs is the max you will pay.
Out of our pocket.
Out of your pocket. So in 2024, there's a donut hole, and you would pay 25% of the cost of your drug until between you and the manufacturer it hit $8,000. That could be a lot of money. So on top of you paying your copay until you hit $5,030 in the second phase. So in 2025, that donut hole is going away, and you will pay whatever your copay. You have a deductible. The deductible is going up to $590 in 2025. Okay, more and more plans you will see deductibles on them. So in the second phase, whatever your copay is, according to the tier on the plan that you have, you will pay that cost until you hit $2,000, and then you're done. You don't pay anything else out of pocket on your prescription drugs.
Will that be regardless of which tier your drug is in?
It's all your drugs combined, tier 1 through tier 6.
Okay.
You're paying your copays. Once you hit $2,000, you don't pay anything else. Now, the caveat gets a little better. If you have several high-cost drugs, and you know you're going to hit that in that first 2 months, right? I mean, if you're anything like me coming off Christmas paying presents for my grandbabies, I'm broke in January, right? So what they have done is they're going to allow you to opt into a program, a payment program that can be spread over 12 months, okay? So if you know you're going to hit that 2,000 in the first couple months, you can tell your pharmacy and your carrier, whoever your plan is, that I want to opt in for the payment program. And what they will do is they will take that $2,000 and spread it over the year at $167 or whatever the equivalent is, up to that $2,000 when you started for the year. So you don't pay anything when you go to the pharmacy, all right? Your carrier will send you a bill. They will be your next, gonna go after you for your money. But yeah, so you wouldn't be paying at the pharmacy. You would get a bill from your carrier. Okay? All right. And then, so the deductible can go up to $590 this year. And they're also going to implement some manufacturer discounts program in 2025. In phase 2, it'll be 10%. In phase 3, it'll be at 20%. And so why is that important? Remember I said in the donut hole, the manufacturer is paying 70%? Well, now they're only paying 10% in the initial phase and 20% in the final phase. In 2024, Medicare was paying 80% in the final phase. Well, Medicare wanted it to make it sustainable and have longevity for Medicare, so now they pushed that cost onto the carriers. So, has anybody in here received their ANOC, or anybody in here on Medicare that received it? Because that comes out, yeah, exactly. That comes out in September, right? A lot of people's jaws hit the floor because they were stunned that some of their drug plans doubled and tripled. Some of the drug plans may not be on the market. So I encourage everybody who's on Medicare and has a plan, take a look at your annual notice of change. Make sure that the plan is still in your best interest. Make sure your drugs are still covered at the lowest cost, because that can really hurt you. So in that final stage, the carrier is going to pick up 60% of the cost. Medicare is only going to pick up 20%. And the manufacturers are only picking up 20%. So it really helps it to be more palatable to the manufacturers, because they will be negotiating prices on some of the most costly drugs, and that'll happen in 2026. You'll see the implementation of that in 2027 for the lowering some of the costs of some of those really expensive drugs. So it's really important for you every year to do a review, and that's what I'm here for. I'm local, I'm right down the street. I promise my clients an annual review every year. I don't charge for my services. I'm really here to help you to navigate through that process. Yes, ma'am?
So, let me just understand this. So, my husband's on Eliquis. So, he's in a chair suite. And we have a copay, like $46. Is that going away in 2025? Those tiers?
The tiers will stay. Okay. Some are going to a percentage, right? So some of that is changing. Look at your plan or his plan.
So we would be going to a percentage possible.
Whatever your plan says it is, whatever that tier is, and it says what the cost is in that tier, that will stay that way. Once you pay your deductible, deductibles get paid first, and whatever the cost of that drug is on that particular plan, you will continue to pay that through the rest of the year until you hit 2,000.
So if it's like $550 for the cost of that Eliquis, which is about right, we would be paying a percentage now.
Whatever your plan
If
is.
the plan says that.
If your plan says that it's 25%, you're paying 25% till you hit 2,000. That's it. You're not paying any more. And it's not just per that drug. It is all of your drugs.
But I'm just always
Accumulation.
looking at that drug 'cause
It's your most costly, I get it.
it's the most expensive.
Yeah, no, it's the accumulation of all your drugs. Once you hit $2,000, you don't pay anything else. All right? So as I said, I can't stress enough to take a look at what you got, do a review. Medicare is very strict. It doesn't allow me to call you. You have to give me permission. On the table over here, this is what's called a business reply card. If you would like for me to call you, and we can set up an appointment to go over your individualized needs and wants, according to what is important to you and your budget, you can go ahead and fill out one of those. I'll give you a call. Annual enrollment is right around the corner. It's October 15th through December 7th. It's a very small window to take a look at and to see if you're in the right plan. And all plans are annually contractual, and they start in January through December 31st. So at this time, is there any other questions? No? Well, I want to thank you all for coming out, spending the evening with me. Thank you so much. We did it in under an hour, so I appreciate your time. Thank you for the questions. You guys had some great questions, and again, I'm here for you. I'm here to work for you, okay? So again, my name is Tina Konieczki, and I thank you for this evening. Thank you to